Welcome to the Digital Health and Fitness Live Studio sponsored by United Healthcare. I'm Dr. Eric Eiting here at CES 2017. With me right now, I have Tom Beauregard. Tom is the Executive Vice President and Chief Innovation Officer for United Healthcare. Welcome, Tom.
Thanks, Eric.
Thanks so much for joining us. So, United Healthcare, I mean, obviously you're sponsoring this, but what's going on with you guys? Like, what are you focused on at this meeting at CES right now?
Yeah, I would say that I'm spending a fair amount of time talking about, and it's a very broad category, but sort of our initiatives in wellness and how we're using devices, FDA-approved devices, trackers to really help people across the spectrum, whether it's just trying to get people to move, like in the Motion program, or much more specifically, helping people that have chronic conditions do a better job with compliance, which is really very difficult.
Yeah. So talk to me a little bit more about that, because wellness is such a broad concept.
Right.
You know, and you talked about chronic conditions. Are there particular disease entities that you're really focused on, and what do those programs look like to translate into better health outcomes?
Yeah, I'll give you a couple of examples. So the answer is yes.
Great.
And I would say we're doing programs with both adults and with children, but specifically for kids, we have a couple of fairly large studies going on right now, one with kids that have type 1 diabetes,
Sure.
and a second with kids that have asthma. And I'll drill a little bit on the asthma one just because it's interesting, I think. Really what we're trying to do is we've got kids that have their inhaler equipped with a Bluetooth cap, so we can measure
Nice.
how often they utilize it, but we can also measure pulmonary function. And they also have an activity monitor that's coupled with this. So on a real-time basis, we can see if there's a lot of use and pulmonary function, and then we can do outreach through a provider to mom, essentially, to try to avoid an ER visit. So that's one example, and I will tell you that the reception to that has been so strong by the parents, the willingness to sign up, because ultimately they're managing the disease.
Right, exactly.
And it's a difficult disease to manage. So a lot of examples like that, and we've got some in the adult space as well, but I think it's really important work.
See, and what I really love about that too is, I mean, I sit here and I think I've worked in a couple of busy public emergency rooms
Right.
in New York City, so we definitely see a lot of asthma,
Yeah.
right? And you think about the number of times where you just get so frustrated by, you know, the number of people who come to the emergency room because they ran out of their medication, or, you know, these preventable hospital admissions. So like, I just love the idea of coupling all of those things, putting everything together, and just stopping the cycle.
Yeah, and to your point, physicians love these programs as well because
I
it
bet.
gives you real-time data and a reason to outreach, and because you see people, if you're lucky, 3 to 4 times a year.
Right.
And you know, and that's with chronic conditions. So this is really just a way to sort of serve the patient, give the physician better information, and get to better outcomes.
Great. Excellent.
Thanks.
Tom Beauregard from United Healthcare, thank you so much for joining us. I'm Dr. Eric Eiting at CES 2017 in the Digital Health and Fitness Live Studio here at CES.